Hey YouTube weight loss family, it's Sherry, the real Share Bear here, coming to you with my 2-week post VSG update. I had my vertical sleeve gastrectomy on April 17th, 2014, Tijuana, Mexico with Dr. Garcia. Any of you who are scheduled to have weight loss surgery in Mexico or Tijuana, or if you're self-pay, or if you have any questions about the process that I went through, just hit me up on here in the comments and let me know. We'll go ahead and start off with the numbers. My high weight was 353. My surgery weight was 333. Last week I came to you at 326 for a 7-pound loss on week 1. This week my weight is 320 for a 6-pound loss for week 2. So I'm pretty happy with that, pretty satisfied. My BMI has gone from a high of 50 to now it's 45.9. So definitely showing some improvement there. So that's good. I saw my primary care physician today, who's the doctor that's actually doing my follow-up care and going to be monitoring my labs for me. Since I don't have a surgeon here in the U.S., she's pretty much the one that's going to be following me going forward. She was pretty happy with my progress. She looked at this incision site that I have that I told you guys bled during surgery, and it had some eschar, or like where it had been burnt, to try to stop the bleeding during surgery, and that came off, and the wound bed is now open a little bit and has like a little bit of yellow gooey exudate at the bottom. So she wanted me to go ahead and start an antibiotic and take it for 7 to 10 days depending on how it heals, just to be on the safe side. So I'm going to be picking that up today. Also, I've been having some pain with my hip doing my cardio, and I asked her about going back on Mobic, which was helping me a lot pre-operatively before I had to stop it, and she was okay with that. She said I could go ahead and start taking that again. I asked her about seeing a nutritionist. She has one there in her office. Also, since I don't have a program to follow, there's no nutritionist included, so that'll be at my own cost, but probably for around $100 I can see the nutritionist. And we decided that next visit, she wants to see me back a month from today, would be a good time to go ahead and schedule with her nutritionist to talk about building a healthy diet, since my pre-op diet was not the greatest. And I told her, you know, I can do broccoli and chicken and green beans, you know, and fish for the rest of my life, but that'll get boring. So I'd like to learn some good habits that I can start as soon as the soft phase starts and go forward with that. So I'll be setting up an appointment to see her next time. I have been getting bored here at home, so I talked to her about going back to work early, and she was fine with that. So we agreed that I would start back to work next week. So I'm excited to see all my people at work. I've gotten a lot of messages and love from them. They've missed me, so I'm ready to get back there. My goals as far as weight goes, the first one obviously is just going to be to get out of the 3s, get into Twonderland, as they call it. Anybody that's ever started in the 3s or 4s, you guys know what I'm talking about. You'd like to see that number start with a 2. So I've got 21 pounds to get to that, so that's going to be my first little mini goal. And then after that, I went with 278 because that'll get me out of the morbidly obese category and into the merely obese category. So those are my 2 weight goals I'm going to be working on for the next little while. I didn't put a time on them. I'm just going to see how the weight wants to come off. Would I like to have shown bigger losses the first couple of weeks? Absolutely, but I choose not to compare myself to other people and let that steal my joy. VSG Tanya always says that comparison is the thief of joy, and I'm not about to let worrying about what other people are doing steal the joy that I feel right now. I love my sleeve. I love my new lifestyle. I'm getting more active. I feel better every day. I can already see some weight coming off in here. I called it my Jabba jowls I had sticking out here. They're already slimming down, and I can feel a big difference around my midsection also. I feel like I can breathe easier at rest even, and especially when I'm exercising. I'm up to 50 minutes on the treadmill, and that puts me at almost 3 miles. So I'm doing well on that. That's longer than I've ever been able to sustain exercise, and my next goal is to start working out for an hour. So hopefully when I get this Mobic on board and start getting some pain relief out of this left hip, I can just keep progressing on that, and so that'll be great. It feels good to be active for the first time in such a long time. So let's see, also I wanted to start morning workouts. I work 312s, and you guys that are nurses or in other professions where you work 12-hour shifts know that it's hard to work out, especially after you get off from a 12-hour shift. I work 7A to 7:30 p, and I find it hard to imagine myself going to work out after I get off from a 12-hour shift, because I'm usually ready to just eat dinner and just relax. So I'm going to try to start getting up early and hitting the Y a day or two on my work days a week and see how that goes to get some extra workouts in, because of course 312s, that leaves me 4 days off from work, and then I figure if I can hit 1 or 2 mornings a week, that'll give me 5 to 6 workout days, but we'll see how that goes. But that's my goal on that. And then I'm going to work on food prep this weekend to get me ready to go back to work this week. I'm starting pureed foods, and I want to have my protein shakes and all my little snacks to get me through the day so I can set myself up for success. And I got a little bag from 31. It's like a tall, thin little bag. I wish I had it with me. I'd show you, but I'm going to try to smuggle it into the OR. We don't normally have any food or drinks back there, but I figured if it's packed away in a bag, I can sip on my water during procedures, and I won't be in danger of getting dehydrated, because breaks are few and far between, honestly, in surgery. So I won't be expecting a lot of special treatment on that, so I'll hopefully be able to stow away my water and keep sipping throughout the procedures, and to help me stay on track there. Speaking of on track, tracking is something that I need to work on. I've given myself some grace right now while I'm in the liquid phase of the diet, because it's so hard to track if you eat 5 bites of pudding, or if you make yourself a quarter or half a cup of soup and you only eat half of it. It's hard to track all that, so I've given myself a little bit of grace until the end of the liquid phase to start tracking on my FitnessPal. I've just been tracking my weight, so that's another goal that I have for this week and going forward, is to start tracking on my FitnessPal. So if anybody has any tips on tricks of how to use that thing, I've gotten on it before, and I found it a little cumbersome to put in exactly what you had and pick out foods. So I don't know if anybody has any suggestions on that. hunger post-operatively, I forgot to mention this in my last video, has been none. I can honestly say I haven't felt physical hunger since I came out of the OR. And for someone like me who's been morbidly obese their whole adult life, I could always eat. And if you asked me if I was hungry, I'd be like, yeah, what have you got, even if I just ate an hour ago. So that's been wonderful. Those of you who are pre-op, I know you can't really get your head around that until you've actually experienced it, because I was the same way, but it was just like a light switch. It turned off that hunger. Now, I did have an episode with head hunger and emotions this week. Lisa works 11A to 11P, and one night she hadn't had a chance to have a dinner break, and she called me to see if I would mind if she came home with some fast food from the Crystal. Now, I don't know if you guys have Crystal in your area, or if you're familiar with it. You might have White Castle, which is similar, with the small little burgers with the greasy little onions and stuff on them. And of course, I thought I was new surgery patient bulletproof, and I'm like, yeah, sure, go ahead, bring it on home, no problem. Well, long story short, I ended up in tears over those Crystals. Sorry, the train's coming through. I hope you guys can still hear me. It's really loud. But Lisa felt terrible for bringing the Crystals home, and I told her, it's not your fault. I thought I would be fine. You thought I would be fine. But something just hit me, and it just took me down from wanting those Crystals. So that was my emotional meltdown for the week. I thought I'd share that with you guys. And after that, I was fine. I mean, the kids have had pizza. I've been cooking for them at night, and it's been no big deal. So that was just a fleeting moment that I thought I would share with you guys. Also, something else I noticed, I don't know if anyone else has dealt with this, I had some skin changes right after surgery. I broke out all over my face in like these whitehead pimples. Just like, it seemed like 100 of them all over my face, which I don't normally break out like that. And then my skin had like a raised rash, and it was really, really dry, profoundly dry. I've been having to moisturize about 3 or 4 times a day just to get that to clear up. So 2 weeks out now, that is clearing up, and I'm feeling better about it. So I don't know if anybody else experienced that. I've never heard anyone else mention it in a video, but I just thought it might be worth mentioning for those of you who have surgeries coming up. You might want to just keep that in mind. I wanted to do a couple of shout outs, and then I'm going to call it quits here. I got a sweet message from Kim Candoit. I hope I'm pronouncing that close to right. She reached out to me on Facebook and said how much my videos have meant to her, and she's enjoyed watching them. And her surgery's coming up in September or October, and I know just where you're coming from, Kim. And so I just wanted to say hey and thank you for letting me know that my videos are touching somebody. It's hard for me to believe that as a baby VSGer, I'm making a difference for somebody, but thanks for letting me know that. And I shouted out to Mama Rose this week. I actually left her a message to thank her for all the work she does in our community, and she's really set the bar high for us. She's lost over 300 pounds, and she's over 10 years out, and her twin sister are just still getting it. If you're friends with her on Facebook, you can see they're out there walking and doing their thing, so it's just amazing. So she was really sweet and sent a message back and watched one of my videos. So it's just wonderful to be able to share with other people that know where you're coming from in this community. So as always, I'm very, very grateful for that. And I also wanted to shout out to Melissa VSG. Her surgery's coming up on May 12th. I watched her pre-op videos and they really touched me. I can totally relate to a lot of the things she talked about in her 10 Things I Won't Miss video. So I just wanted to give her a shout out, Melissa. If you guys don't follow her on YouTube, check her out. She's a really cute girl. And also my friend TK Sleever, her surgery is coming up on May 12th too. So I wanted to give her a shout out real quick. And that's all I have for you guys today. I'm excited, loving my sleeve, and I'll talk to you guys next time. Bye.